shift work and the price of staying awake. 3 in the morning. A nurse in Riyadh is charting vitals. Her body is screaming that it should be asleep. But here's the thing nobody tells you. Staying awake at night doesn't just make you tired. It actually rewires your heart. And we're only now figuring out how badly. So what if the person taking care of you in the middle of the night is operating on a cardiovascular system that's slowly being remodeled by the very job that keeps you alive? Welcome to Turns Out, where we explain real research in plain English. Healthcare workers do something most of us will never do. They work when the sun goes down. And I mean really work. Not the kind of checking email at 11 p.m. work that we all do. The kind where you're responsible for keeping people alive while your circadian rhythm is throwing a tantrum. For decades we've known this was bad. We knew it disrupted sleep. We knew it was stressful. But we kind of hand-waved it as an occupational hazard, you know. Someone has to do it. The real cost? That remained fuzzy. Most research on shift work has been done in Western countries with different healthcare systems, different work patterns, and different populations. Saudi Arabia, with its unique climate, cultural context, and healthcare demands, has been a blind spot. Until now. This new study isn't just another shift work is bad for you confirmation. It's the first comprehensive national look at exactly how bad and across which healthcare workers it's worst. This research comes from a consortium of scientists across Saudi Arabia. The lead author is Fahad H. Algharbi, based at Imam Abdul Rahman bin Faisal University in Dammam, and he collaborated with researchers from universities and health institutions across the kingdom. This isn't a small university lab project either. This is a national cross-sectional study published in May 2026 in BMC Public Health, one of the world's largest open-access public health journals. What's interesting about the team is their diversity. You've got respiratory therapists, physiotherapists, dentists, pediatricians, and quality and safety officials all working together. This isn't accidental. You need different perspectives to understand a problem this complicated. Here's how they did it. Imagine you could take a snapshot of every healthcare worker in Saudi Arabia on the same day and ask them about their sleep, their health, and their safety records. That's essentially a cross-sectional study. The researchers recruited healthcare workers across multiple professions and locations, and they measured several things simultaneously. How much shift work each person did, especially night shifts, their sleep quality using standardized questionnaires, their cardiovascular risk factors, including blood pressure and heart rate measurements, and their occupational safety incidents, like needle stick injuries or medication errors. The clever part is they didn't just look at people who work nights versus people who don't. They looked at cumulative exposure. How many years have you been doing this? How many night shifts per month? It's like comparing someone who occasionally smokes a cigar to someone who chain smokes 3 packs a day. The dose matters. What they found is genuinely unsettling. First, the sleep quality data. Healthcare workers doing shift work, particularly those with heavy night shift exposure, reported significantly worse sleep quality than day shift workers. But not just, I'm tired, worse. We're talking increased insomnia symptoms, difficulty falling asleep, and fragmented sleep that never reaches the restorative stages your brain needs. Now your body needs those deep stages of sleep. That's when your cardiovascular system downshifts, your blood pressure drops, and your heart gets a break. Workers missing those stages, their cardiovascular systems don't get that break, and this is where it gets darker. The study found a clear association between shift work and increased cardiovascular risk markers. We're talking elevated resting heart rate, higher blood pressure, and metabolic changes that are precursors to heart disease. The effect wasn't tiny. Workers with 5 or more years of rotating shift work showed cardiovascular risk profiles more similar to people 5 or 10 years older than them. Your body ages faster on the inside when you're working nights. The third finding is almost worse. Occupational safety incidents, Everything from needle stick injuries to medication errors to falls increased with both the amount of shift work and the quality of sleep. Essentially, the less rested you are, the more likely you are to harm yourself or someone else. A healthcare worker running on poor sleep is both a sicker person and a liability in the hospital. So what does this actually mean for the real world? If you work in healthcare and you're doing nights, this isn't fear-mongering, it's information. You're not weak for struggling with shift work. Your body is literally fighting against its own biology. The circadian rhythm isn't something you can bargain with, it's hardwired. For hospital administrators, this becomes a cost-benefit question. Yes, someone needs to work at night, but the individual cost to that person is accumulating. And the safety cost to patients is real. This doesn't mean shut down hospitals at midnight. It means we need to think about scheduling differently, maybe shorter rotations, maybe better sleep support, maybe actually paying night shift workers more because they're literally trading their health. As for limitations, this study is cross-sectional, meaning we can't prove shift work causes these problems. It's possible people with predisposition to poor sleep seek out day shifts, but that's not a plot hole. That's just how science works. We find association, and then future studies test causation. Where does this fit in the bigger picture? In Europe and North America, there's been a slow movement toward regulating shift work schedules because of similar findings. But most healthcare policy worldwide still treats night shift work as an unfortunate necessity rather than a genuine health intervention problem. This Saudi Arabia study is important because the Middle East has growing healthcare demands and young healthcare workforces. It's a region where you could actually implement better scheduling before bad habits calcify. The research raises bigger questions. What if hospitals staggered shift work differently? What if they prioritized certain tasks being done during day shifts only? What if they invested in circadian-friendly lighting and scheduling technology? And here's the one that keeps me up at night, no pun intended. How many medical errors currently blamed on individual negligence are actually circadian-driven cognitive failures? How many cardiovascular events in healthcare workers are being treated as lifestyle problems when they're actually occupational diseases? Turns out, the person who stays awake to keep you healthy is paying for it with their own health. And we've known that vaguely for years, but now we have numbers. We have cardiovascular risk profiles accelerated by a decade. We have clear associations between fatigue and safety failures. The real question isn't whether shift work is hard on healthcare workers. It's whether we're going to actually do anything about it, or whether we'll keep shrugging and saying someone has to do it. Scientists have been busy, and they're not done yet.